What are some of the major complications that you counsel patients on that may occur?
There are three major ones I talk them about. And they're really getting less because of techniques we use. So let's start with stroke. You fully blood thin them up to that point. You'll either do a TEE at the time of the study, but a lot of times people are going to a CT ahead of time so they can take a look and make sure there's no clots. And there are different ways to get around that. And then you get into the heart. But even with all your best efforts, there's probably a 1% chance that they can have a TIA or a stroke. You can perforate the heart, you get a tamponade. Again, probably less than 1%, but somewhere 0.5 to 1. And then you worry about damaging a pulmonary vein, getting pulmonary vein stenosis. Now, we haven't seen that in a long time because we use intracardiac echocardiography, ICE, it's called. We put a catheter up and we image the left atrium. The ways you get pulmonary vein stenosis if the catheter gets into the pulmonary vein and you ablate in there. If you stay on the outside, you almost never get pulmonary vein stenosis. So we haven't seen that in a long, long time. And of course, the really dangerous one is developing what's called an atrioesophageal fistula. That's been minimized by using temperature probes during the study in the esophagus. But I still quote people about a 1 in 1,000 risk. Most people don't care about a 1 in 1,000, but I mention it to them. So I tell patients you have about a 1 to 2% chance of a major risk, and those are the three I quote. I tell them that if they're a routine patient, I quote them about 65 to 70% total success. If they've been in AFib for a long time and have a big left atrium, I'm usually quoting them 45 to 50%. I don't want them to go in there with false expectations, but that's what I do. And then I tell them you're going to stay on blood thinners for a while afterwards. If your chance VAS score allows you to go off of them, probably around 6 to 8 weeks we'll stop them. But if you have a high chance VAS score, we're not stopping the blood thinners. You shouldn't go have an ablation with the concept you're going to stop your blood thinners because that's not what we're going to do.